Hey everyone, welcome back to the channel. Today we're going to talk about diabetes. Diabetes is a serious illness that affects millions of people worldwide. You're probably familiar with the most common symptoms of diabetes: excessive thirst, frequent urination, constant hunger. But did you know that diabetes can show up in some pretty unexpected ways? We're going to dive deep into 10 surprising symptoms of diabetes that you definitely don't want to ignore. Recognizing these early signs can make all the difference in getting the right diagnosis and staying healthy. So stay tuned. Alright, let's jump right into our first surprising symptom: dark patches on the skin. You might notice these patches on your neck, armpits, or groin. They appear a bit velvety and darker than your normal skin tone. This skin condition is called acanthosis nigricans, and it's often linked to insulin resistance. Basically, insulin is like a key that lets sugar into your cells for energy. But when your body becomes resistant to insulin, it's like the key isn't working properly and the sugar can't get in. This resistance can lead to a buildup of insulin in your blood, and high insulin levels can actually stimulate skin cell growth, causing these dark patches to appear. While acanthosis nigricans is more common in people with type 2 diabetes, it can also be associated with obesity or hormonal imbalances. So, if you spot these patches, it's worth checking with your doctor to rule out any underlying conditions. Our next surprising symptom is unintended weight loss. I know, it seems contradictory, right? We usually associate weight loss with health, but when you're losing weight without any effort, it can be a warning sign, especially for diabetes. You see, with diabetes, your body has trouble using glucose, which is the sugar from the food you eat, to make energy. And when your body can't use glucose effectively, it starts looking for energy somewhere else. Unfortunately, that somewhere else usually means breaking down muscle and fat for energy, which leads to weight loss. This rapid and unexplained weight loss is usually more noticeable in cases of type 1 diabetes, but it can also happen with people who have poorly managed type 2 diabetes. So if you notice that the numbers on the scale are going down without changes in your diet or exercise routine, don't ignore it. It's essential to talk to your doctor to find out what's going on. Feeling dizzy once in a while isn't usually cause for alarm, but if it happens often, it could be related to your blood sugar levels. Dizziness can be a symptom of both high and low blood sugar. When your blood sugar drops too low, a condition called hypoglycemia, it means your brain isn't getting enough fuel to work properly, leading to dizziness. This can happen if you skip meals, take too much insulin, or exercise intensely without adjusting your food intake. On the other hand, very high blood sugar, known as hyperglycemia, can also cause dizziness. This usually happens because of dehydration, as your body tries to get rid of the extra sugar through urine, or it could be a sign of a more serious complication called diabetic ketoacidosis, which we'll discuss later. Bottom line, if you're experiencing persistent dizziness, don't ignore it. See your doctor. Let's talk about your vision. Are things looking a bit blurry lately? Having trouble focusing? You might be surprised to know that changes in your vision can be a silent symptom of diabetes. You see, when your blood sugar levels are high, it can affect the lens in your eye, causing it to swell. This swelling can make it hard for your eyes to focus properly, leading to blurry vision. And if left unchecked, high blood sugar can damage the tiny blood vessels in your retina, the back part of your eye that senses light. Over time, this damage can lead to diabetic retinopathy, a serious eye disease that can cause vision loss. Diabetes also increases your risk of other eye problems, like glaucoma and cataracts. So, if you notice any changes in your vision, even if they seem small, don't wait. Make an appointment with your eye doctor right away. Early detection and treatment are crucial for protecting your precious eyesight. This next symptom might be a little more, shall we say, personal to talk about, but it's important. Diabetes can really impact your sexual health. For men, high blood sugar can damage the nerves and blood vessels that are crucial for getting and keeping an erection, leading to erectile dysfunction, or ED. And while we often hear about ED in men, It's important to remember that women with diabetes can also face sexual health challenges. High blood sugar can lead to vaginal dryness, making intercourse uncomfortable, and it can also affect arousal and the ability to reach orgasm. It's important to remember that sexual health is a vital part of overall well-being. So if you're experiencing any problems in this area, don't hesitate to talk to your doctor. There are treatments available that can help. You might not think of frequent infections as a symptom of diabetes, but there's actually a strong connection. When your blood sugar is constantly high, it weakens your immune system, making it harder for your body to fight off infections. This means you're more likely to get sick, and when you do get sick, it might take you longer to get better. We're talking about common infections like yeast infections, urinary tract infections, skin infections, and even respiratory infections like colds and the flu. So if you're always fighting one infection after another, or if you notice you're getting sick more often than usual, it's worth checking your blood sugar levels. Keeping your blood sugar under control can help strengthen your immune system and lower your risk of infections. Ever feel like you're on an emotional roller coaster? Well, those mood swings you're experiencing could be linked to fluctuating blood sugar levels. Think about it. Your brain relies on a steady supply of glucose for energy. When your blood sugar drops too low, your brain doesn't get the fuel it needs, and this can lead to sudden mood changes like irritability, anxiety, and even confusion. On the other hand, high blood sugar can make you feel tired, sluggish, and unwell, which can definitely affect your mood. If you're noticing that your emotions are all over the place and you can't figure out why, it's worth talking to your doctor about checking your blood sugar levels. We've all had dry skin at some point, especially in the colder months. But if you're dealing with persistent dry skin, particularly on your lower legs, feet, and ankles, it could be a sign of diabetes. High blood sugar can impair your skin's ability to retain moisture, leading to dryness, itchiness, and even cracking. And to make matters worse, diabetes can also damage the nerves in your extremities, a condition called diabetic neuropathy. This nerve damage can cause a variety of strange sensations, including tingling, burning, or even numbness, which can add to the discomfort of dry skin. If you're struggling with dry skin that just won't get better, don't just reach for a moisturizer. Talk to your doctor to rule out any underlying medical conditions. This next symptom is a bit more serious and needs immediate medical attention. If you notice a sweet, fruity smell on your breath, it could be a sign of diabetic ketoacidosis, or DKA for short. DKA is a life-threatening complication that happens when your body doesn't have enough insulin to use glucose for energy. As a result, your body starts breaking down fat for fuel, and this process produces ketones, which are acidic waste products. When ketones build up in your blood, they can make your breath smell sweet, almost like acetone or nail polish remover. DKA is more common in people with type 1 diabetes, but it can also happen in people with type 2 diabetes, especially if they are very sick or their blood sugar is extremely high. So if you notice this fruity smell on your breath, along with other symptoms like excessive thirst, frequent urination, nausea, vomiting, or stomach pain, don't wait. Seek medical help right away. Our last surprising symptom of diabetes is dry mouth. Everyone gets a dry mouth from time to time, especially if we're dehydrated or nervous. But if it's a chronic problem for you, it could be related to your blood sugar levels. High blood sugar can reduce saliva production, leading to that unpleasant, sticky, dry mouth feeling. And it's not just about feeling thirsty. Saliva plays a crucial role in maintaining good oral health. It helps remove food particles, neutralizes acids in the mouth, and protects teeth from cavities. When you have chronic dry mouth, your risk of developing dental problems like cavities, gum disease, and mouth sores increases. So, if you're constantly reaching for that glass of water or chewing gum to combat dry mouth, talk to your doctor. That's all for today, everyone. We've reached the end of our video on 10 surprising symptoms of diabetes that you should never ignore. Remember, Knowledge is power when it comes to your health. By being aware of these lesser-known signs and symptoms, you can take control of your well-being and seek early medical attention if needed. If you found this video helpful, give it a thumbs up and share it with your friends and family. Don't forget to subscribe to the channel for more informative videos like this one. And as always, thanks for watching and see you in the next video. Bye-bye.